It was back in the 1980s. The crack cocaine epidemic ravaged the black urban community. It was not, if you'll recall, treated as a public health crisis like the opioid epidemic of today, but rather criminalized through mass incarceration.
And that has left many African Americans with resentment, often dismissing the opioid epidemic as a white suburban problem. I had a very candid conversation with two people who say that attitude needs to change.
Have you heard similar things, and are black folk right to feel that way?
Well, history bears it out. I mean, when the crack epidemic hit the black community, all we got was a crackdown, right? And so we were criminalized for addiction. Families were broken apart not only by the addiction, but also by the criminal justice system and the massive lockup of our citizens. So yeah, that did happen. You know, I just don't like to get into comparative miseries, because we know that you can't contain something like this, and that at some point the chickens come home to roost in the black community where there isn't the support and where there aren't the programs and people don't have access to care.
Darryl, what are your thoughts on it?
I feel that it's not a black thing, it's not a white thing. You know, it's an insidious disease that thrives on opportunity.
We all know somebody who suffers with substance abuse, but we don't really talk about it. Is there a stigma?
If there is, we need to get over it fast. And if we weren't able to get over it during the crack cocaine epidemic, you know, we need to figure this out now. So the answer is yes. I mean, not just in the black community, in every community, people have a bit of shame around addiction and not understanding the disease and not understanding how it needs to be treated, not as a crime, but as a disease. We can pretend this is a white people's problem until our children are dropping dead. I mean, you talked about the age of children who are being exposed to this.
Yeah, I mean, we're interviewing and screening families to have children as young as elementary school age, you know, fifth graders, you know, that are being exposed due to the lack of medication adherence. You know, grandma goes out and she has hip surgery or knee replacement surgery. She's prescribed an opioid. She brings the opioid back and no one's told grandma at the hospital to lock up your opioids. You know, take your prescribed dosage and lock it up.
Your final thoughts and any words that you would like to get out to people who would look at this and say, it's still a white person's problem. Desiree?
Don't say that. You know, like Darryl just said, it's a people problem, and we are not safe. And we ought to know from experience that when the majority culture, you know, catches the flu, we catch pneumonia. That it's going to be triply more lethal when it does come to our community.
And you know, we have to be careful as a community to not be fooled by a cunning disease. You know, if we get into dealing with the race card, we will lose focus on very precious information that will lead us to resources. The white community, the black community, the Hispanic and Latino community, you know, the Asian community, we're all dying. You know, so we need to adhere, listen, stay attent, you know, so that we can help save collectively all lives.
And there has already been an uptick in opioid deaths in the black community. Mr. Dewberry, who you just heard from there in the piece, and you'll hear from him later in this program, he says he has seen the number of African Americans that come through his addiction clinic triple in just the past few years due to opioid abuse.